So when we started working on the initial idea for Charlie Health, virtual intensive treatment as a concept didn't exist. So we were playing around with, how could you make treatment accessible? And I was running at the time virtual alumni groups for people coming out of residential treatment. And I saw how much they enjoyed engaging virtually. And so we started delivering virtual group therapy in an intensive outpatient program. And I think that we were able over time to build trust with people. We knew that the peer connection piece would be so important, that the reason that people would show up for 11 hours a week of therapy would be if they got along with the people in the group, if they had that connection, if they felt seen, if they felt heard, like I had gotten to experience in a residential treatment center. We knew that if we could deliver that virtually, that would draw people into the therapeutic experience. And what that looked like was ensuring that every single person had a peer in their group that they could connect with, but that also the professionals in our community felt supported by our local team. So even though we were delivering care virtually, we hired boots on the ground teammates so that they could get to know the community, so they could get to know the providers in the community, the librarian, the school counselor, the social worker at the local hospital. They formed relationships with those people so that we could really ensure that the local community trusted Charlie Health. The initial vision too was just giving treatment to people that needed it who were in crisis. Over time, it has been how do we ensure that it's the best treatment, that we are delivering world-class treatment to every single individual and delivering the best possible outcomes. We saw early on that in order for us to be successful at building this world without suicide, we would have to be exceptional at other conditions as well, like substance use disorder, like eating disorders. There are different things that people struggling with substance use need versus people who are just struggling with mental health. And we want to employ the best evidence-based practices to ensure that we are helping people get well and stay well. We will continue to respond to the demand, respond to the people who come into our program and say, I'm struggling with my mental health and my eating disorder, and ensure that that person is met with open arms, met with evidence-based care for their primary diagnosis as well as their secondary diagnosis, and that we continue to offer this gold standard of high acuity care to every single person who needs it.